Hi, it's Clemmy from the NARM Clinic, and in this week's video I'm covering nutrient deficiencies in IBD and why it should be an important focus when we're managing the conditions. So first of all, prevalence of nutrient deficiencies in inflammatory bowel disease. So deficiencies in micronutrients, so those are our vitamins and our minerals, occur in more than half of people with IBD. And we get most micronutrients from the food that we eat. Now, micronutrient deficiency is associated with a prolonged and more complicated course of disease, so worse symptoms, more problems in people with IBD, because micronutrients play a really important role in our bodies, including things like supporting and regulating our immune system, but also helping to support our energy levels as well. So correcting any deficiencies and supporting our nutrient intake should always be a really important consideration when we're managing inflammatory bowel disease. So the most common micronutrient deficiencies are iron, vitamin D, vitamin B12, zinc, and folic acid. So what causes these deficiencies, and is there a difference if you have Crohn's disease or ulcerative colitis? So there's many reasons why people with IBD might be deficient in some micronutrients, and these include things like restricting food intake or avoiding certain foods if they perhaps exacerbate symptoms. Also issues with absorbing nutrients, so that might be due to inflammation or due to fast transit time, so things moving very quickly through your intestines. And the other one is perhaps due as a side effect from some medications. So if you have Crohn's disease, then you're actually more likely to have nutrient deficiencies than if you have ulcerative colitis. And this is because Crohn's often affects the small intestine, and it's in the small intestine that we absorb most of our micronutrients and most of our nutrients. It's also more common to have nutrient deficiencies during flare-ups than during periods of remission. So the type of IBD you have and the area of the intestines affected and the severity of the inflammation are all really important considerations when we're looking at food and nutrient status. So for example, in Ilio colitis, and that is the most common form of Crohn's disease, and that's where inflammation affects your ileum, which is the last part of your small intestine, and also it sometimes as well affects some of your large intestine. So your ability, when you have ileocolitis, your ability to absorb some nutrients, particularly vitamin B12, can be affected because vitamin B12 is absorbed in your ileum. Now, if you have ulcerative colitis, where the inflammation is in your colon or your large intestine, you are perhaps more likely to be iron deficient, and that is because of blood loss through bleeding, through ulceration. So it's really important that we test for this and then support accordingly if there's a deficiency. So with just those two examples, you can see why it's so important that we deal with Crohn's disease, ulcerative colitis, and all the different subsets within those conditions differently and personalise everything we do to you and what you're dealing with. So what can we do about it? So I'm going to give you 4 tips here. So the first one is to get tested. So if you think you might have a nutrient deficiency, then you can go to your GP and you can have a simple blood test. So not all nutrients can be effectively tested for, but we can test for iron, B12, vitamin D and folate in a really simple blood test. So request a blood test from your GP or from your gastroenterologist if you're worried you might have a deficiency. Number 2 is what happens about correcting deficiencies. So if it's discovered that you do have a deficiency, you may need to supplement that specific nutrient and also include more foods that contain that nutrient in your diet. And in some cases, you may need injections or infusions to help support levels of that nutrient. And that's mostly in B12, vitamin B12 deficiency and iron deficiency. But something that's really important here is please don't just supplement without seeking advice first from a nutrition professional or your doctor, and without knowing whether you have a nutrient deficiency or not. If you have a deficiency and you don't supplement properly, it may not even have any impact. And it may also cause more harm than good if you supplement without needing to. So I'm going to give you a couple of examples. So if you have a vitamin D deficiency, you may need to supplement at a higher dose for a short period of time to help rectify that deficiency before then continuing on a kind of lower maintenance dose first. But first we need to know whether you have a deficiency or not, and then at what dose to supplement according to how bad that deficiency is. On the other hand, in terms of perhaps causing more harm than good, is supplementing with iron may actually increase and exacerbate some inflammation, and also cause symptoms like diarrhea and nausea. So we want to avoid making anything worse if we can. So be careful about supplementing if you haven't been encouraged to by your nutrition professional or your doctor. Number 3 is about preventing deficiencies. So we can help to prevent deficiencies by ensuring that we're eating a diverse range of different foods and food groups to help ensure that we don't put ourselves at risk. So have a look at the blog that accompanies this video, and it'll link through to my balance plate and portion guide, and that'll help to make sure you're getting all the different food groups at each meal to help reduce the risk of deficiency. And number 4, the final one, is to get help. So if you're on a very restrictive diet, or you worry you're at risk of nutrient deficiencies, or if you have a nutrient deficiency and you're not sure what to do about it, then get help from a nutrition professional, and so they can help make sure that you're getting all the nutrients that you need in your diet, and also recommend the best quality supplements to help reduce that deficiency. Anyway, I hope that helps, and we'll see you again soon.